Right, let's stay in the UK and connect with my colleague Baba Tandor. Baba, it's good to see you or hear you. What is the situation where you are?
I mean, in the UK, it's more about fear and panic amongst the citizenry. I mean, the streets are getting emptier and emptier by the day. I mean, you wake up. If anybody knows South London very well and does know Mitcham, you know that Mitcham is a very busy area on every single day, even late into the night is very busy. But now Mitcham is more like a ghost town. And I've been to other areas within London and the situation is similar. What you find on the streets more these days are police personnel. The police now can stop you and ask you where you are going. And if it's not to the pharmacy, if it's not to buy essentials, or if you're not an essential or key worker, you can be fined between 60 to 80 pounds on the spot. And so that's basically what's happening. Now, if you go into the shops, there's what they call controlled entry. So there's a long queue, which is very unusual, a very long queue, and people are allowed in 2 at a time. And so there won't be more than 3 people at a till at a particular time in a shop. And then also in the shops, you see inscriptions such as this item can be sold only at 3 units per person. And so the social distancing is actually happening a lot in the shops. I mean, if you even get close to someone in the shop, they tell you, hey, excuse me, could you please keep your distance? You know what's going on. And basically that's what's happening. What you also find now is a lot more private taxis parked. And I mean, initially you wouldn't see taxis parked, on a regular working day. You see them on the streets, but now you find, I mean, where I live, for instance, you can find about 5 or 10 taxis parked at the same time. And this is because the taxis are owned by people who live in this vicinity. Taxis are just parked. You see a lot of the drivers doing more gardening with their families, with their children. Basically, that's just what's happening. And then the buses, the TfL buses are also less patronized now. You get on the bus, and instead of a full bus, or at least expecting about the bus to be about 70 to 80% full, now you see people just started. So I think the maximum I've seen on the bus is 5 full, including myself. People are not patronizing the buses anymore because actually there's nowhere to go. If you're found at the wrong place at the wrong time, you could be fined. And people are trying so hard to avoid this. And then also, what they worry about the most is the fact that the NHS, the National Health Service, could get flooded and could get overwhelmed. And they're doing everything possible to ensure that that doesn't happen. So what they've done is to open up the doors to people who would like to volunteer to work for the NHS. So I think this was done on Tuesday, and as we speak, more than 1 million people have registered to volunteer for the NHS. And also the NHS is calling back retired doctors and nurses and other, allied workers who used to work with them, who have all gone on retirement. They are calling them back, just so that they could come help with the situation in case it gets out of hand. And then we are also seeing social care workers. They can't stop working. More or less, they work in close relation to the NHS. So these are auxiliary helpers to nurses. So what they do is to go from house to house, or the other care homes or hospices where these social care workers do those work. Those are also categorized in the key workers zone, and so they are also having to go to work. And then let's talk a little bit about business. So right now, the shops, apart from the major shops like Asda, Iceland, Aldi, Wilko, and all of that, the other shops, the corner shops, are having to close because not many people are patronizing. Either they are closing or they find daily sales or patronage very, very low, which is not encouraging. And so they'd rather stay home than to come and open up the shops and not have anyone come by. And I'm sure, Kojo, today you've heard the breaking news, the biggest news in England at the moment, the fact that the Prime Minister Boris Johnson and his Health Secretary Matt Hancock have both tested positive. So I mean, as of yesterday, the number was 181 less than it was, or than it is today. So what it means is that in 24 hours, the number of cases increased by 181 in England. Boris Johnson is having to self-isolate in 11 Downing Street. Whatever it is that he's expecting it's usually put in front of his door. So he says his food is left in front of the door. If he has any work, it's left in front of his door. I mean, he's not having contact at all, no physical contact with anyone. So it's Mark Hancock, the health secretary. And before then, it was in the Buckingham Palace, Prince Charles, who tested positive and also has had to self-isolate in a castle. So as we speak, Prince Charles is also self-isolating in a castle. And so, Kojo, basically, this is what's been happening here. And one more thing I haven't mentioned is the fact that the money transfer service is actually reducing. I've been finding out from some of the vendors, and it's not really booming as it used to. Now they usually tell you that Western Union is actually not working at all. I don't know if it's a complete shutdown or whatever, but it's Western Union. You wouldn't get to they're not working at the moment. Their services are low. What you would find is MoneyGram, and I think other ways in which people send money, and so it's affecting almost every sector of the country, and basically that's what I can tell you for now. So if you have anything else to ask me,
managed to answer every single question I have without me asking a single one of them, and that's amazing. Thank you so much. That's quite a comprehensive update there. But I hope you're keeping safe, and I can't wait to get another update from you very soon. That's our colleague Tando there with every single thing you could possibly have wanted to know about the situation in the United Kingdom with COVID-19.